Joints are the structural connections between two or more bones in the body, facilitating movement and providing mechanical support. They play a vital role in human locomotion and stability. So joints can be classified based on their structure, function, and movement capabilities. This video explores major classifications of joints in details. Number 1. Structural classification of joints. The structural classification is based on the type of connective tissue that joins the bones and the presence or absence of joint cavity. These categories include 3 types. A. Fibrous joints. These joints are connected by dense connective tissues, primarily collagens, and they lack a joint cavity. They allow little or no movement, and examples include sutures, found in skull, and are not movable after childhood. Syndesmosis. They are found in long bones such as the tibia and the fibula, and they allow minimal movement. Gomphosis. A peg in socket joint, such as the connection between the teeth and their sockets. B. Cartilaginous joints. These joints are connected entirely by cartilage and also lack a joint cavity. They are slightly movable, and examples include synchondrosis, which are bones united by hyaline cartilage, such as the epiphyseal plate in growing children. Then symphysis, which are bones connected by fibrocartilage, such as the pubic symphysis, synovial joints. Synovial joints are the most common and movable type of joints. They have a joint cavity filled with synovial fluid, which reduces friction and facilitates smooth movement. Examples include the knee joint, the shoulder, and the hip joint. Another classification of joints is the functional classification. The functional classification is based on the degree of movement permitted by the joint, and they include A. Synarthrosis, which are immovable joints. These joints permit no movement and are primarily designed for protection. Examples are the sutures found in the skull. B. The amphiarthrosis. They are slightly movable joints. These joints allow limited movement, providing a balance between stability and mobility. And examples include intervertebral discs and the pubic symphysis. C. Diarthrosis. They are freely movable joints. Diarthrotic joints are freely movable and they correspond to synovial joints. They include various types based on their movement pattern. The first one is the hinge joint. They allow flexion and extension, and they are found in the elbow and the knee. Then the ball and socket joints. The ball and socket joints permits rotation and movement in all directions, such as the hip and the shoulder joints. Then the pivot joints. They allow rotational movements, such as the movement between the atlas and the axis in the neck. Then the saddle joints. They allow movement in 2 planes, like the thumb joint. And then finally, the plane joints. They permit gliding movements, such as in the intercarpal joints. Now, another classification of joints is based on their movement. So joints can also be classified based on their range and type of movement. The first one is non-axial. They are gliding movements and without rotation. Examples are the plane joints. Then the uniaxial. Their movement is in one direction. An example is the hinge and pivot joints. Then biaxial. Their movement is in 2 planes. An example is the saddle and condyloid joints. Then the multiaxial joints. Their movement is in multiple planes. An example is the ball and socket joints. So, in conclusion, joints are essential for functioning of the human body, and their classification helps in understanding their structure, function, and movement capability. Whether fibrous, cartilage, or synovial, joint ensures our body can perform a wide range of actions, from walking and intricate hand movements. So understanding joint classification is very important for medical students and those seeking knowledge in medical field. And it helps in diagnosis and treatment of joint-related disorder effectively. So this is the end of this video. If you like this video, please don't forget to like and subscribe.